So let's talk about nipple necrosis. That is a very scary word to hear, and it is something that a lot of patients have concerns about. And that's basically when you're doing a breast lift or a breast mastopexy, what you're doing is you're cutting around the areola to raise the nipple in a higher position. When you're doing that, you're cutting some small little blood vessels to the nipple and the areola. There is a risk of enough blood supply lost to where you lose partial or full amount of the nipple. Basically turns kind of black and has a scab and can slough off. So that's what everyone's concern is. And that is a legitimate concern. Anytime you have an operation around the areola, a surgeon will talk to you about that risk. What is the risk really to the patient? Well, it depends on a lot of factors, right? So if someone's had a breast reduction before, or if they've had multiple operations around their areola, or if their nipple needs to move very high. Let's say their nipple's kind of facing the ground right now, and it needs to move way, way high to kind of get it to a good central position again. Well, that's a bigger move on the areola. That's a little higher risk of nipple loss or nipple necrosis. When the implant's above the muscle and you're doing an explant, that's also a little bit higher risk of nipple loss or nipple necrosis. I've done these operations for a very long time. I do a breast lift very commonly at the same time as I'm doing a breast explant. And for patients that have had multiple operations around their areolas, multiple lifts before, even some reductions before, I think a breast lift can be done very safely at the same time as an explant and minimize the risk of nipple loss or nipple necrosis. Obviously, that's very dependent on the patient. If they've had, like I said, some of those higher risk factors, we would talk to them about, is this risk worth it to do the breast lift for you at the same time? But I would tell you for about 95 to 99% of patients, it can be done very safely with a conservative nipple repositioning at the same time as the breast explant.